بسم الله الرحمن الرحيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. It's my pleasure to show for the professors and dear colleagues and students of the General Surgery Department the huge caseload and the work done in the pediatric surgery unit. So this is our development progress for the treatment outcome of newborn presented with intestinal atresia and stenosis in a period of 5 years, from 2008 to 2011. Intestinal atresia is a well-recognized cause of obstruction in the newborn. The aim of the study is to examine the serial cases regarding the intestinal atresia and stenosis in a period of 5 years in a developing country like Egypt and to display our progress in treatment and survival rates. It is a retrospective cohort study with a total 103 intestinal atresia and stenosis cases retrospectively evaluated. The cases were divided into two groups. The first group, 60 cases from 2008 to 2011, where it was impossible for TPN or total parental nutrition to be used. The second group is 43 cases after 2011 to the end of 2012, where TPN was possible. Both groups are studied as regard the terms that affect mortality, which is mainly prenatal diagnosis, the age on admission, the prematurity, the associated anomaly, the general condition, the postnatal perforation. For the study, for the statistical difference, it is accepted when the p-value was less than 0.05. In the cases included in the study, the level of obstruction was duodenal in 37 cases, which is 39%, jejunal-ileal in 60, and colonic in 6. In the first group, there were 18 duodenal cases and 38 jejunal-ileal and 4 colonic atresias. In the second group, there were 19 duodenal cases and 22 jejunal-ileal and 2 colonic atresias. This is a graphical presentation of the percentage of each type. And here we discuss here in this table the different types and the presentation of each case. And there is no statistical difference between both groups, group 1 and group 2, as regard other factor than total parental nutrition. This is the procedure done in cases of duodenal atresia, which is mainly duodenojejunostomy and diamond-shaped duodenojejunectomy. And this is the procedure performed for cases of jejunal-ileal atresia, which is mainly wide proximal resection and anastomosis, which is higher in the ileal type, and minimal proximal excision and anastomosis, which is higher in the jejunal type. This is the complication we found in our patient, which is mainly wound infection. The result, in the first group, the total parental nutrition was not applied to any of our patients. In the second group, total parental nutrition was applied to 15 duodenal atresia cases for 12 plus or minus 8 days and was applied to 20 jejunal-ileal atresia cases for 59 days as average. For colonic atresia patient, total parental nutrition was not required. While the survival rate was only 55% before 2011, after 2011 it was 94%. As a result, long-term regular total parental nutrition usage significantly improved survival in newborn with intestinal atresia and stenosis in a developing country. In our patient before 2011, there were defects in the supply of total parental nutrition solution. Thus, total parental nutrition administered for a long period of time and regularly could not have been possible. However, after 2011, routine use of total parental nutrition was made possible. We prefer using total parental nutrition in a peripheral cannula rather than central cannula with higher complication rate in the central type. Conclusion. To the best of our knowledge, this study is the second largest serial in English literature, include the largest serious survival from a developing country. While rates of 89 to 90% are reported from developed countries, survival rate such as 85 to 71.5% are reported from developing countries. As shown in our study, we can deduce that in a developing country, the survival rate of newborn with intestinal atresia or stenosis will be at a very good level as it is in developed country. As a result, it can be said that regular uncomplicated use of TPN over a long period of time when necessary dramatically stabilizes the rate of survival. This is all my work is dedicated to my father, and the one who taught me everything as regards surgery and life, Dr. Professor Nuruddin Al-Kholi. And see you on June 30, inshallah.